Although congenital heart disease is often considered a childhood condition, advances in surgical treatment mean that most babies who might have died now survive well into adulthood.
But that survival rate is now presenting new challenges. For one Nebraska woman, it meant the risk of having a heart attack if she had a baby. Reporter Lindsay Thies has a story in her special report.
A baby is a blessing. No one may know that statement truer than Laura Kingston. Laura was born with a deformed heart. 10 years ago, she had her first baby.
I can remember being home and in the middle of the night, my son's crying and I can't breathe to get to his room, to get to the crib. It was confusing, it was scary.
Her heart was failing, but doctors replaced her valve and she was okay. Life went on.
As life has it, I ended up becoming pregnant again, and that's when we noticed the transition of this next valve.
All of a sudden, Laura was back to where she had been before, her heart struggling to keep up with the pregnancy. To complicate things more, Laura's unborn daughter wasn't growing. At 28 weeks, doctors put her on bed rest.
It had gotten significantly worse.
For the next 2 months, Nebraska Medicine was home. Doctors were on standby, afraid Laura's heart would stop, assessing, reassessing, not just her case, but her daughter's.
How is growth today, and does baby meet all the other parameters to be able to proceed with the pregnancy, or do we need to talk about delivery now?
Laura said she never lost hope.
This is a gift. This is a miracle. This is meant to be. And the thought of termination just wasn't an option.
The program at Nebraska Medicine is almost as rare as the cases they deal with. Doctors have built a multidisciplinary program for adults with congenital heart disease, the first select physicians ever to receive board certification in this subspecialty. Doctors work between Nebraska Medicine and children's hospitals, seeing more than 1,000 congenital heart patients each year.
They've got somebody that now understands what it means to be an adult with these baby diseases.
There can be unforeseen complications that come up during pregnancy, and we like to manage these women so that we're really doing everything to prevent complications from coming up.
These maternal fetal medicine specialists are following the Passion Project to underserved areas too, including the western part of Nebraska and all the way up to South Dakota. The result? Situations like this. Mothers who a decade ago would have been told to avoid pregnancy don't have to.
And she looks like she's gaining weight.
As for Laura, on March 7th, she underwent a C-section at Nebraska Medicine with a massive team in the delivery room. Cardiology, anesthesia, NICU, OBGYN, all on standby to replace her heart valve. They didn't have to.
She's so cute.
Laura's baby was born safely at 4.5 pounds, and she now weighs over 6 pounds and is doing well.
I'm just so thankful. I'm so thankful that she's healthy and that she's here.
What a blessing. Lindsay Thies, KMTV, Action 3 News.